There's many different things that we consider when we are presented with a new bone grafting option. I think we look at several different factors. One, is it really going to change my practice? And by changing my practice, it doesn't mean necessarily about the surgeon themselves, but it's really, is it going to improve the patient's outcomes? And that is really predicated on evidence-based medicine. So the more data that we have about products, as well as what preclinical studies and certainly clinical studies have done to show that they have efficacy much better than what's previously out there. And that really gets into the component of value. And so value is not just cost in terms of inherent or endemic cost, but it's also the ultimate benefit to the patient. Ultimately, as value becomes more of a proposition and more of a mainstay with our current medical practice, it's very important for this. And so I think it really comes down to ease of use for the surgeon, reproducibility, can we use it in every single case, and does ultimately have good outcomes that's really predicated on evidence-based medicine.